If a registered nurse presents a concern for patient safety, should that nurse continue working in the home?
Wanda Saganesi, like other managers at Crescent Care in Woodstock, Ontario, was aware Wettlaufer had become a danger to their patients. So they fired her in 2014. But within weeks, the care home reached a settlement with Wettlaufer's union, the ONA, Ontario Nurses Association, that prevented a potentially costly and uncertain arbitration process. It was a deal that came with conditions.
Are you pleased to provide someone a reference for whom you thought was placing a resident's health at risk?
That was not the context or the thinking.
Crescent Care gave Wettlaufer a letter of recommendation, $2,000, and agreed to call the firing a voluntary resignation. Paul Scott represents the families of two of Wettlaufer's victims.
You must have known that she was then going to go out into the world again and apply for another nursing job somewhere, didn't you?
Yes, but that would be the case even if we went to arbitration and won.
Either way, the arbitration findings would have been made public, a potential red flag against Wettlaufer.
If they wasn't disclosed, how was I supposed to know?
The union's Jill Allingham also blamed Crescent Care, accusing the facility of not revealing everything they knew. Yet Allingham conceded the union didn't wait for all the facts before deciding to protect Wettlaufer. Scott wonders if the settlement put the public at risk.
You have a staff member on your hands that's not up to being at your residence anymore. Do you really want to then send them back out into the world looking for employment?
The inquiry has been told that Wettlaufer went on to find more work and more victims. She injected 3 more patients with massive amounts of insulin. 2 of them survived, a third didn't. Meanwhile, her latest employers never had a full picture of who or what they were dealing with. John Lancaster, CBC News, St. Thomas, Ontario.